Good morning. Right. Mr. Gale.
Good morning, my lord.
Good morning.
We have three witnesses today. The first is Natasha Claire Hamilton.
Very good, thank you.
For reference, her statement is SCI-WIT 0370 and then 5 zeros 1.
Yeah, now, I think we may have the first technical hiccup of the morning because we've got a new, I don't know what we call them in this building, but new attendee. And I'm not sure if she knew to go and get the witness.
I think she's outside.
Is she outside? So perhaps I'm doing the lady a disservice, for which I apologise. Could you? Yeah, I'm very grateful to you, if you would, please. Oh, you may not be needed. Thank you anyway. Good morning, Miss Hamilton. Welcome back.
Hello, Miss Hamilton. You've given a statement to the inquiry. I've given the reference to that, and it will come up on the screen as you're giving your evidence. You've already given evidence to the inquiry as part of the organisational presentation of Care Home Relative Scotland. Just to confirm, your full name is Natasha Claire Hamilton, I think?
Yeah, that's correct.
How old are you?
37 now.
Yeah, you were 36 when I think you gave your statement, yeah. So we can change that. Okay. The inquiry has your contact information. I think you're currently a student.
Yes.
Right? Yeah. Now, you're here to give evidence today about your mother, Anne Duke. Mm-hmm. And I think Anne Duke is the Anne of Anne's Law.
Yeah, that's correct.
And later this morning, we'll also hear from your father, yeah. Campbell Duke.
Yeah.
Can I just caution you at the moment, Miss Hamilton, that while you can obviously mention your mother's name, your father's name, please don't mention the name of the care home in which your mother was a resident. Yeah. Now, we know from your statement that your mother sadly died during the pandemic, although not of COVID per se. I think her cause of death was given as Alzheimer's and pneumonia. Yeah,
but just to add to that, she did catch COVID at the beginning of the pandemic.
She had COVID.
Yeah, she had COVID, yeah.
And she died on the 13th of November, 2021. So the inquiry is conscious that the second anniversary of her death is imminent. And can we send to you from the inquiry team and to your father our condolences in relation to that. Now, you tell us that your mother was diagnosed with Alzheimer's in 2014 when she was only 56.
Yeah, and I think that's quite important. Yeah, yes. Quite young.
And at that time, she was still independent and living at home with your father.
Yeah.
And you also say that you did not realize as a family the level of care that she would require as a dementia sufferer.
Yeah, when I knew about dementia, I just thought people forgot stuff. I didn't realise you would become a full-time carer. Yeah.
And I think you also had guardianship
yes.
of your mother once she had been diagnosed with dementia. And that was a role you had alone, I think. Is that right? Not in conjunction with anyone else?
No, my dad was initially the main one, but then I stepped over, so he was like secondary. So,
okay,
yeah.
Thank you. Now, her disease progressed so that in, I think it was 2018, she had become non-verbal. And at paragraph 8 of your statement, you indicate that once she had gone into the hospital, the system really took over. Is that right?
Yeah, I believe so, yeah.
And she was admitted, I think, into hospital on an interim basis. Sorry, into care on an interim basis. But that became a permanent arrangement.
Yeah, we were told there wasn't enough. There would be no support for her to be cared at home for my family.
And I think she was 60 at the time that she went into care on a full-time basis. Is that right?
That's correct.
If you just look at paragraph 13 of your statement, please. I think there is a background to this, that you weren't particularly happy about your mother going into care, because I think you as a family wanted to care for her at home, or to continue to care for her at home. Is that right?
Yeah, we've been doing so since Mum had been diagnosed, and as you stated earlier, when Mum went into hospital, that's the only time I felt that there was intervention, and it was against our wishes and Mum's wishes, and we just needed a little bit more support to keep Mum at home. But I truly believe that because she was under 65, the easy option was to force us to put our Mum into a care home.
Yeah, you say you felt your hands were tied behind your back.
Yeah.
Can you just explain why you say that?
Mum, if you're diagnosed with dementia under the age of 65, there's very little support in the community for you. Like, for me personally, I struggled. There was zero support for my mum. I think if she was over the age of 65, we might have been able to get a bit more care at home packages for her, but I truly believe that because of her age, she was discriminated against, and the support she was needing at that time, it might have cost less money for localities to put her into a care home as opposed to give us more support to keep my mum at home. And we'd been our main carers up until then.
Yeah. And you were willing to remain in that role as the main carer, as a family, as I understand.
Absolutely, yeah.
Okay. Paragraph 14, you do mention, as it were, the reception into the care home that your mother went, and I think reading short, you say that the staff there made you and presumably your mother feel welcome into the care home.
Yeah, and that's partially the reason why. So it was an interim bed, and then when we realised we weren't going to be able to get Mum home, we had to then find a permanent care home for her, and that is partially the reason why we chose to keep her in that care home, because the length of time she was in there at that time, it just felt natural. The staff got to know her. We felt like they got her as well for the little time she was in there, and they just made the transition a lot easier for us. So yeah, it felt the most natural thing to keep her in there.
Yeah. There are 3 points you make in the following paragraphs, and I'll just really summarise them. First of all, in the pre-pandemic days, your mother had many visitors in the care home, both family members and friends. And in fact, your father was effectively able to, put it this way, camp out almost in the care home. He could be there to assist your mother with eating and companionship, and he was almost a semi-permanent resident in the care home. Would that be fair to say?
Yeah, I would agree. Yeah. And similarly, because I lived in Edinburgh and Mum's care home was back East Kilbride, for the full day when I would go and visit, I would use the same term. I camped out there. I got to Mum's in the morning and I didn't leave again till 5, 6 o'clock at night till heading home to Edinburgh.
And I think, as you say in paragraph 18, the care home became a second home for us all.
Yeah.
You could spend Christmas there and presumably birthdays.
Yeah, especially, we were told this when Mum went into the care home by numerous bodies that were part of that transition, treat this as your mum's home. So we took that mentality on. And especially when Mum turned 60, the care home put on a massive party for Mum, and that was just as Mum moved into it. So that, again, that helped with the whole feeling like it will never feel normal, but it helped us feel like this is a nice place for Mum to be. This is a place for us to come, spend some quality time with Mum. We know she's been looked after, and we can come and go. And it felt as natural as a transition can be into a care home, from my opinion. Yeah.
Thank you. One other point you make, and I think it's probably quite a significant one, is that it wasn't perhaps understood by some people about the grief and bereavement that your father suffered as a consequence of losing his wife to dementia and then into a care home. Can you just explain that a little?
Yeah, living grief and bereavement is something I feel very strongly about. When someone is diagnosed with dementia, you lose them every single day. They're part of their brain's dying, and you're losing that part of them every single day. For your loved one to be then have to move into a care home, you're losing that contact with them again. Some people aren't able to make phone calls or not able to use text messages. So for that to happen, that is a big loss in someone's life. And I remember actually asking the social work, is there support put in place for partners in those positions? And they were told, no, we're only here to look after your mum.
Okay. And I think we're aware from your father's statement, and we'll be hearing from him later this morning, is that he did suffer considerably from the grief of losing your mother into the system and into the ravages of dementia.
Yeah, and that's why I took over his mum's guardianship. That's why.
Yeah. Now, the other point I'd like to just take from you is that I think you and other members of your family, particularly, became part of the team that helped the staff with your mother's care when she was in the care home pre-pandemic. And if one looks at what you say at paragraph 19 of your statement, you say that you felt you were helping ease pressure on the staff, and also you knew that they appreciated that.
100%. My mum's dementia got to a certain point where she needed everything done for her. So if I was in there with my mum, helping her drink and eat, even listen to her music, communicating with her, that eased up pressure on staff to go and be with other residents whose families, who maybe didn't have families to be in with them, or whose families weren't able to visit at a certain time. They were able to go and help out those other residents because they knew that I was there with my mum, and they trusted me because they knew that we got to know each other. So for me to be there with my mum, it clearly releases pressure on the staff, because there's only so many staff within wards, units, and that's across all care homes. They're quite stretched, in my opinion. So for families to be in and helping out their loved ones, it will ease pressure on staff. I think that's just a given, yeah.
I think one of the points you made in that answer was quite important, that the staff could trust you for the work that you would be able to do with your mother. Yeah,
I never felt at any point anyone was checking up on me. Yeah, pre-pandemic, it was Natasha's in her mum's room. She's fine.
Yeah. Now, obviously your mother was a resident in the care home pre-pandemic, but you do note that COVID took hold in the care home and 19 residents in that care home died. Is that right? Yeah. Do you know over what period that was?
I couldn't give a definitive answer, but I do think it was at, so when my mum was diagnosed with, she got COVID in April of that year, yes. And I think it was around about that time a lot of the residents started passing away, so I think it was at the beginning of it, but I would need to have that clarified.
No, it's not necessary to give exact detail, but if you could, I just wondered if you know. I think you also surmise that, I think it is an assumption on your part, that individuals were being sent to the care home without being tested for COVID.
So, yes, that is my opinion. And my opinion is that from what we now know, that care home residents were sent to, people were sent from hospitals to care homes untested. We know that's been publicised. And the reason why I think it was my mum's, because my mum's care home was an interim care home, so the local hospital was next to my mum's care home, so that is me just putting one and one together, maybe getting 3, but maybe getting 2. But just to quickly clarify, in the 19 residents that passed away, we were never told.
Yeah.
So I just wanted to add something.
I understand that. The give me a moment. At that time, obviously, and we're into the pandemic and the effective exclusion of you as a family member from your mother's care home. You say at paragraph 22 that, as the last sentence, however, keeping families locked out didn't prevent COVID getting into the care home at that early stage. Is that another one of the reasons why you assume that it may have been caused by people being transferred from hospitals into the care home?
It could either, it only got in two ways, either getting from staff or somebody being transferred from a hospital, because they were the only people that were able to access the care home at that point.
Yeah, and I think you also say that there were interim beds in the care home, so it had available space for people.
That's, again, from my experience with that care home, because Mum's was an interim bed, I'm assuming that that's possibly might have been used,
You made the point, and I'll ask you just to make it again. You were not told by the care home that there was an outbreak. I think you found out about that through social media. Yeah,
it's a very unfortunate situation that happened. We saw it on social media as a family, and then we assumed that it maybe just, it was leaked. But then I knew other families that had someone in that care home, and they're like, no, we were told 2 or 3 days ago. So I got in touch with the care home. They were very apologetic. It was quite a traumatic experience again, because we don't know anything about Mum. We were kept away from her, and all of a sudden we find out there's COVID in her home through social media. Again, that just highlights again how stretched staff were, that somebody was forgotten to phone. If we were still able to go in, one person, bear in mind my dad, then he would have known at that point, because that contact would have been there for my mum.
And even within the, let's assume there wasn't the facility for you or your dad to go into the care home, one would have thought, well, I ask you, did you imagine that all families of residents within the care home would be informed of the outbreak within the care home?
I would like to imagine that that would be the case, yes.
Yeah. Okay. Now, moving on, there was the possibility in April 2020 that your mother might have to go into hospital. Is that right?
Because she contracted COVID,
yeah. And as I understand it, that in fact didn't happen initially.
No, so it did eventually. So Mum contracted COVID, and the care staff were worried about her. So they phoned us, and they phoned an ambulance. The ambulance came, and there's more detail in my statement, I know, but from my memories of it is that when the ambulance came, they said that there was nothing they could do for my mum at that point, so that's why they wouldn't take her into hospital.
You explained that at paragraph 25 of your statement. There's something that did crop up at that time, was you received a letter from your mother's GP practice on the 30th of March 2020. And you quote from that letter in paragraph 26. Now, your father also quotes from that letter in his statement, I think a fuller quote. But I wonder if you'd just read what that letter said to you.
Many patients already have anticipatory care plans regarding their wishes for future care and avoiding hospital admission, but not all. Ideally, these discussions would take place in person in a calm, non-time pressured way, but this is not possible. We will not abandon you or your loved ones, but I need to be frank with you regarding the realistic outcome of if they were to get COVID-19. It is extremely unlikely that if they were to be bad enough to require ventilation, a machine to breathe for them, that they would survive. If residents become unwell, we will work together to provide the best support care we can within the nursing home. We have access to comfort medications for end-of-life care, known as just-in-case box, should things reach that stage.
What was your reaction, you personally, what was your reaction to seeing that letter in those terms?
I feel like my mum was just written off because of where she lived. She wasn't given a chance, like from the offset. That's genuinely how it feels. No one else in the community would have had that. If my mum had dementia in the community, I don't think she would have received a letter like that.
Your mother was subsequently admitted to hospital, which I think that was something that the care home had pushed for. I think you see that in paragraphs 27 and 28 of your statement. You weren't allowed to accompany your mother to hospital, were you?
No one accompanied, not even a member of staff. It was the paramedics and my mum on her own, a non-verbal, vulnerable person.
And just to set it in context, your mother was non-verbal at this stage?
Non-verbal.
Yeah. This may be a difficult question to answer, Ms. Hamilton. Did your mother have any cognitive function at that time? Do you think she understood what might be happening?
I don't think she would have understood what's happening, but I think it would be wrong to think that she was aware that she was being moved from her familiar surroundings with familiar people into an ambulance, loud noise, who knows what was happening in the ambulance, again into a loud environment, different visualisations that she could see. I think she would have been quite uncomfortable with that. That's definitely something I think, because if I was to walk into my mum's room, she would recognise me. She might not be able to verbalise it, but you would get some sort of recognition. So she did have that ability to recognise certain things and noises as well. So those would have definitely played an impact on her being moved from one familiar place to something that's not.
It's perhaps taking this out of certainly out of the line in your statement, but one of the things that I picked up from your statement, and indeed from your father's, is that your visits to see your mother in the care home pre-pandemic were very important both for your mother and indeed for you and your father.
Yeah.
Because I think what we will hear, particularly from your father, is that he was able to have some well, I'm sure you did as well. You're able to have eye contact with your mother. He was able to touch her. He was able to, I think he would massage her hands. And there was an element of sensory connection between him and your mother, and indeed between you and your mother. And that was important, I think, was it?
Yeah, you've used the correct word there. I've always called it sensory communication with my mum. If I was never in the room with my mum, I would go 6 days a week having no contact with my mum, because that's just the way it was pre-pandemic, and that I understood that to be her illness. So that one day when I would always make sure I was there, that meant the world to me, because I knew that she knew that I was there and I hadn't abandoned her. Yeah,
okay. Your mother's transfer to hospital in April 2020, as you said, you weren't allowed to accompany her. Were you told in advance of her transfer?
Yeah, we were at the care home, were on the phone with us pretty much. Someone's on the phone to us and someone's on the phone to 999, so we were aware of that at that point.
Once she was admitted to hospital, did you have difficulties in communications with the hospital to find out how she was?
There was nothing from the hospital. If we weren't a family that were proactive, we would not have known anything. We took to phoning 3 times a day to get information on my mum. Now, who knows if they'd maybe got in contact with us if we hadn't phoned 3 times a day, but there was no, we'll phone you at this time every single day to keep you updated on your mum. So again, she was in an environment on her own, non-verbal, and we were still sitting back, not knowing what was happening with her.
And it was effectively the onus on you to make contact with the hospital in order to find out how your mother was?
Yeah,
Okay. Obviously, you weren't allowed to see your mother in hospital.
No.
And you make the point in paragraph 30 of your statement that it had been 2 months since you had last seen your mother.
Yeah.
Because of the lockdown of the care home.
Yeah.
And one of the difficulties, as I understand it, with that situation was one might imagine that a family member like yourself, who is constantly at your mother's care home, would be able to appreciate the perhaps subtle changes in your mother's condition.
Yeah.
And you, because you hadn't seen her for that length of time, you and your father weren't able to notice those.
Yeah, you're unaware of how she's changing day to day.
And so, for example, you wouldn't be able to give that information to the hospital.
No, and that's again where the whole restrictions thing frustrating, because when Mum was in the care home, we weren't really allowed to have much contact in terms of person, but as soon as she went into the hospital, the onus was on the family. It was the family that was having to tell the hospital, my mum can do this, my mum can do that, but not the care home. But yet when she was in the care home, it's okay, it's the care home that are looking after her. So it's picking and choosing when the families can be involved and when they can't, is what that felt like.
I think some of the examples that you give are, for example, what were features of your mother's behaviour, and also what were her food preferences. So you weren't able to or the hospital wasn't necessarily aware of those. Yeah,
we were unsure if they were just leaving food next to her, thinking that she was able to eat. So we had to make sure that they were aware of that as well, and aware of the types of food that she was able to eat.
Now, your mother was in hospital on oxygen for about 2 weeks, you tell us in paragraph 30 of your statement. And she was released from hospital on the 10th of May. This is, I think, something that you weren't told about in advance.
No, the care home contacted us to let us know. I don't even know. We were only told my mum showed up at the care home. They phoned us to let us know that Mum was home.
So the hospital didn't tell you?
No.
And it was the care home, having received your mother back into care, who told you?
Yeah.
And I think your mother had to have two negative lateral flow tests.
Yeah, we were
before
aware.
She was readmitted into the care home.
Yeah, we were aware of that, and we were aware that we're waiting on the results coming back. So we just weren't told when the right results were to send her back.
And as you say in paragraph 32, your mother attended our hospital again in October 2021, and we know that was immediately prior to her then being returned to the care home and to her death in November.
Yeah.
Yeah. And now you talk about your mother's care and her condition before the pandemic in paragraphs 35, 33 and following, and we can read that. As well as the impact that dementia had on her, rendering her non-verbal, she'd also lost the power to move independently, I think you say.
My mum the dementia had destroyed my mum. Like she was not able to do anything for herself at all. She was bedbound / chairbound pre-pandemic, I would put it, because we were able to help her get out of the bed and sit in the chair, and it was like one of these comfy chairs that she would be able to be supported in. But out of that, she really couldn't do anything else for herself.
And I think she had also started, if she was moving independently, if she could move independently, she'd also started to drop to the floor.
Yeah, so that was when she was first moved into the care home. That was that period.
Yeah. And I think it's also right to note that you do note that in relation to the care home, there was always a staff nurse on duty.
Yeah, so that goes back to her being admitted, I don't know what she used to phrase, when she moved into the care home. We were always arguing that if they were saying that she had to move into the care home because she needed someone with her all the time. So we were arguing, well, there's not enough staff to be with my mum at all times, so my mum could get up out of her bed at that point, and she could do that thing where we felt that she was just needing to sit down, but she wasn't aware where a chair was, she would just drop to the ground. So that was our argument about, well, she's not always going to have someone with her, so eventually the social work, this package agreed that they would give money for another member of staff to be on shift with my mum at all times to ensure that there was someone with her. And that, so yeah.
And I think in paragraph 38, and please don't name her, but I think that you do mention that there was one carer in particular, and you describe her as amazing.
Yeah,
Yeah.
yeah, sorry, don't know what that made me cry. She was amazing. And
Well, that's your word.
and even through the pandemic, she was the person that still let me be connected to my mum. So yeah, she was worth her weight in gold.
Thank you. One matter I'd like to pursue with you is what you say at paragraph 40 in your statement about communicating with your mother. We've touched on this a little. And I don't want to go into the minutiae of your mother's condition and how she was, but I think she apparently did have some difficulty in lifting her head.
Yeah, she certainly towards the beginning of the pandemic, if you want to put it that way, like she would be like pretty much hunched over. She didn't really, so that's why when she was in the chair or bed, it was good, because the chair could be reclined, so her head would be up. But then depending, she would then just start slouching down. So most of the time, you would spend your time on the floor trying to like get her attention and let her know you're there.
Yeah. But she did apparently understand, or at least manifest that she understood your presence, because she could smile still.
Yeah. I'll always stand adamant that I got to a certain point where I didn't know if my mum knew I was her daughter, but she knew I was someone that made her happy in her presence. And yeah, me being there, certain smiles and jokes and music, I would be able to get some smiles and acknowledgement from her, definitely.
And I think the point I made earlier, that your dad used to go in and massage her hands, and I think that was in the context of, I indicated to you earlier, that the significance of sensory contact. And I think what you say at the end of paragraph 40 is probably quite important. You say, these were precious moments, as I could not communicate with my mum without these visits.
Yeah, that was the only communication I had with my mum, was when I was in the room with her, holding her hand, singing songs with her, playing her favourite music. As soon as I left my mum's room, I knew that I would have no more contact with her until the next time I was able to visit. So you cherish those moments that you had with her.
Put simply, you couldn't phone her up.
No, like the lines of communication with my mum disappeared. The communication with my mum is being in her room, in her presence, next to her, holding her hand, talking to her. Out with that, I was never able to communicate with my mum because of the way the dementia had affected her.
Right. In paragraphs 43 through to 47, you talk about the way in which you and your father could provide fruit and drink for your mother. And obviously once you were unable to visit her, all that stopped.
Yeah, and no, that's not me saying that the staff weren't doing that, but that goes back to when staff are stretched. When I would visit mum, I'd be with her all the time, so she'd be getting lots of fluid and lots of fruit and lots of nutrients in her. But obviously staff aren't able to spend that as much quality time with every single resident in there, so that's why I feel that was a very important point to bring up.
Yes. And perhaps could you just read to the inquiry paragraph 47 of your statement?
So for the first 2 or 3 months of the pandemic, my mum may as well have passed away. We had no contact with her. We didn't know how she was. It was just us phoning and asking a couple of questions. Mum just disappeared from our lives all of a sudden. My dad would phone the care home and get information. My only complaint would be that they didn't tell us enough information.
I don't want to preempt what your father is going to say, but one of the points he makes in his statement, I'm sure you've seen his statement, is that he would phone. Indeed, you presumably also phoned. And the response generally from the care home, and I don't think you're being critical of them in this regard, was that you would just be told that your mum was fine.
Yeah, and you understand why they were saying that. But I would always argue that she's not fine, she's got dementia. Dementia is affecting my mum every single day. I don't know how much longer we have left my mum. I need to know, how much has she drank today? Is she been able, like, not to go into too much detail with my mum, but I need to know information about my mum. She's got a disease that's killing her. She's not fine. So that, yeah, that was very frustrating. And it made you sometimes feel like a nuisance, like phoning all the time, but I just needed to know how mum was, yeah.
Just on that, that's your perception, or a possible perception, that you were being a nuisance. Were you ever felt to be being a nuisance?
Sorry?
Were you ever felt like you were being a nuisance by contacting the care
No,
home?
I would definitely say that. I didn't ever... The care home never made me feel like I was a nuisance. I felt like I was maybe being a nuisance because I was phoning all the time, or as a family. And you just had that understanding of that because there wasn't families in, they were being stretched to look after all the residents. So you felt like you were adding an extra pressure onto them that wouldn't be there normally if we were in the care home.
Yeah, thank you. Now, you then in your statement tell us about restrictions on visiting. You tell us a little bit about the pre-pandemic situation, and I think you've told us about that already, that several members of your family could go, you could have events, effectively parties, when it was appropriate, you would be able to see how your mother was during all that period.
Yeah.
Yeah. And I think one of the concerns that both you and your father had after the pandemic struck and the restrictions were put in place was that you were concerned that your mother wasn't just sitting in her room all day or sitting in a chair all day. Is that sum up, perhaps very simply, one of your concerns?
Yeah. And again, just to bring it back to the reason why she was in the care home was dementia, and there's not a cure for dementia, but keeping her stimulated, in my opinion, helps me think that I may be keeping my mum here a lot longer, so that stimulation that she didn't get.
Mm-hmm. Yeah. Right. Going back slightly, your mother's care home closed down in mid-March 2020, is that right?
Yes.
Yeah. And I think you were told that they were closing as a precaution, and this was prior to the rest of society being locked down.
Yeah, that's
I think you can date it because it was very close to Mother's Day.
Yeah, yeah.
Yeah. There was, I understand, a Facebook page established in an attempt to maintain contact. But was that of any benefit to your mother?
No, and that's, I think you've got a key point there. There's a lot of times there's the impact about me and how it affected me, but it's me seeing pictures of my mum. Okay, I can see her, but my mum still had no contact with her family, even though we were able to see that she was in the day room and participating in activities or whatever. My mum was still shut off from her family, so it didn't matter how many pictures we would see.
Yeah. I think you say precisely in paragraph 53 that this just wasn't working for your mum, whether it was Facebook or whether it was a video call or FaceTiming her.
Yeah.
Didn't work for her.
No, no. None of it worked. Technology didn't work for my mum.
Yeah.
She needed someone to be in the room with her. Yeah. I'll repeat that as long as I ever need to. That's the only thing that would have worked for her, to have any sort of connection with anyone.
Yeah. I don't want to cause you any particular pain, Miss Hamilton, but we're looking at impacts, and obviously the principal impact is on your mother. Mm-hmm. But we're also looking at impacts on you and your family. How did you feel when you were unable to gain some sort of personal contact with your mother during this period?
You feel you'd let her down.
Yeah.
I remember pre-mum going into a care home, lying in bed with her one night, and she seemed scared and shouting out, and I was like, don't worry, Mum, I'll always protect you. So I remember when my mum went into the care home, and I remember that first day leaving to go home, absolutely horrific, thinking that I'd let my mum down, that we weren't able to keep her at home. And then for us then to have that impact again, that she was in the care home and we weren't even allowed to be in and be with her. It's just horrific for someone to be non-verbal and not able to communicate, to not be allowed to be with her family just because of where they lived. I felt like I'd let her down.
Yeah. Did you feel guilty about it?
Yeah, because I feel guilty about it, but I feel like also we did everything we could as a family, and that goes back to what I said about our hands were tied behind our back. So I feel guilty, but I feel like I have fought tooth and nail for my mum to try and do what I can for her.
Yeah. Now, looking at the effect on you, the effect on your mum, obviously, you can only really surmise that. But you do so from an informed perspective. Yes. You had been with your mum for many years, suffering from dementia, so you knew probably better than anybody, possibly your father may have known a bit better, but you probably knew better than anybody how your mother was reacting. In this period that we're talking about, when you weren't able to see her, weren't able to talk to her, have any physical contact to her, and I appreciate it's probably a surmise, but how did you feel that your mother was reacting to it? How do you think she felt about it?
I remember writing a blog about it from my mum's perspective, and the words I kept using was like, I feel abandoned. Those faces that she knew that were visiting her all the time have just disappeared. We don't know if she understood why they weren't there. So the only way I can think is that she must have felt abandoned from the familiarities that we used to bring and visiting her.
Right. You first saw your mother again in August 2020, so several months on from March. And this was in what you term a garden visit.
Yeah.
Now, that was obviously arranged with the care home. Was that at your behest, or did the care home invite you to it, or how did that occur? That
was just the guidance was now allowing garden visits. So then it was just widely known that you could be able to see someone in a garden.
Yeah. Paragraph 55, you said garden visits were horrendous, and you give some explanation of that. Can you explain why they were horrendous?
So within Mum's care home, although we're calling them garden visits, they weren't garden visits, they were at the entrance to the care home. Part of me is like, yes, okay, I get that, because they were able to, like, during the cold months, the resident was able to be, or my mum was able to be inside the care home, so keeping herself warm. But there was no privacy in it. Because it was at the entrance of the care home as well, staff could come in and out while you're trying to have, I can't even call it private, but have a moment with your mum. But then it's also, she was still having to be 2 metres apart, like I stated earlier. She was in a wheelchair, hunched down, facing the ground pretty much, and I'm having to shout at her like this. And she can't speak to me either, she can't do anything, so you're just shouting at my mum. That's all the visits contained of. And the only thing you could get from it was that, well, at least she's hearing my voice. But again, I'll go back to with the video calls, she's hearing my voice, but she's not able to realise where it's coming from. So when I'm next to her holding her hand, I can get her, and I'm here, Mum, I'm here. But if I'm shouting at her, she's just not able to really grasp where I am.
One of the points you make is that there was a lack of privacy.
Yeah.
Again, can you give some context to that?
Yeah, especially when garden visits first started, a member of staff had to be present during the full visit. I don't know if that was a care home. From my campaign, I know that happened quite a lot of care homes as well, but it made you feel again that you weren't trusted. But I was trusted to be alone in my mum's room pre-pandemic, so it just made you feel like that, like, we need to watch you in case you do something wrong to infect the care home. Like, it made you just feel like you were just not trusted to be with your mum. with my mum. And just the fact that you're just out in this big open space with all the windows and people could just look at you and staff could come and go and you maybe had someone waiting for their garden visit and the bench next to you. So it wasn't private at all, especially after all those months of being kept apart. For your first contact or your first able to try and reconnect with someone to be in that manner, there was no privacy at all. It just, yeah.
Presumably in these visits you would want to exchange personal information, even if your mother perhaps couldn't understand it.
Yeah.
And you would want to disclose things to her. You would want to be intimate with her.
Yeah.
And these were denied to you.
They were denied to us. We couldn't do that, but staff were able to wheel her in, sit next to her, talk to her. Your husband and daughter are here, but then we were the ones that had to keep back.
Yeah. How did that make you feel that you would have a member of staff accompanying a mother in that situation? How did that make you feel?
I felt sorry for the member of staff as well to have to be in that awkward environment. But I also remember my first visit, I wanted to walk away. My body was trying to get me going, my feet were glued to the ground for my dad's sake, but I felt humiliated that my first contact with my mum was in this so-called garden visit environment. I remember a staff watching over me, and it just felt like, what's going on? Why all of a sudden am I not allowed to be my mum's daughter? Why am I being looked at in this way?
Okay. Now, we know that your mother sadly died in November 2021. You weren't with her when she died.
I was waiting my turn, to put it.
I think your dad was with her.
My dad and my sister. I was up in my in-laws' house because I wasn't able to enter the care home until a certain point. I had to take a PCR test, a COVID test. And I got to my mum's room and I opened the door. And my dad was frantic, and I just looked at my sister, and my sister just nodded at me. And I'd missed being with my mum by seconds because we had to stagger who was coming into the care home.
Yeah. You tell us about that at paragraph 61. I'm sure it's upsetting for you, and I won't ask you any more questions about it. Thank you. Talk about essential visits, please. Paragraph 62 of your statement. Now, can you just tell us a little bit about what your understanding was in relation to what are termed essential visits? So
I was made aware of essential visits around about possibly September 2020 by someone who worked in Alzheimer's Scotland. Yeah. And he made me aware that, no, actually, you should be getting in, your mum should be having essential visits because they're there for distress and end of life, and your mum's dementia is definitely causing her distress. But that wasn't made widely commonly known to anyone. I only happened to know it through all my campaigning, and this person happened to get in touch with me and say, like, no, like, you need to use this. And when I got in touch with the care home to ask, and I kick myself all the time for this, because I was just trying to comply to the rules, and I emailed them asking, are you aware of essential visits? And they said they were aware of them. I asked, are you doing them? They said no. I was like, well, how are you making sure that somebody might be qualified for an essential visit? And they said that they're assessing everybody every single day. And I get annoyed that at that point I didn't push for it.
Yeah, I think you say that that you were told that I think no one qualified for such visits. Yeah, and you're saying with the benefit of hindsight, you wish you'd pushed harder on that.
Yeah.
Was one of the reasons why you didn't push harder on it because you didn't really know about it?
I didn't know too much about it. I didn't know the rules. And then you've got that fear again. Not fear's maybe the wrong word, but you don't want to rock the boat. Yeah. I can't get in to see my mum, so you don't want to upset the people. And that's me not saying that anything bad had happened to it, but you don't want to upset the people that are looking after your mum when you're not able to get in there. So sometimes you just think, oh, okay, and you're so exhausted by fighting all the time that sometimes you just accept an answer, and Yeah.
So on your part, was a sort of passive acceptance of the situation rather than arguing about it, if I can put it that way?
Yeah, as I say, like I kicked myself and I hate the fact I didn't push for it, but possibly at the time it was just exhaustion of everything you had to try and do to fight. You're like, okay, well, that's another door shut. I thought this might have been a way in, but clearly it's not.
I think it's at paragraph 67 of your statement that you say that you came to understand that essential visits could be for end-of-life care or end-of-life situation, and or if the resident was distressed.
Yeah.
And obviously it came to the point where your mother was unfortunately in both of those categories.
Yeah, so I had almost medical evidence to back up. Despite the fact that Mum had dementia, that's medical evidence in itself that she's distressed and she should have someone with her. But we had a doctor who had a look at my mum's health at that point, and she said that I do think your mum's end of life, and that was an understanding that it doesn't mean it's the next couple of weeks. It could be like this is her slowly starting to pass away. So that was a year before my mum passed away, actually.
You became, obviously, and we've heard this from you in your evidence you gave 10 days ago, you became part of the care home relatives group. And at paragraph 68, you say that you contacted two individuals, and again, I ask you not at this stage not to name them, you, as I understand it, were suggesting that the guidance should be changed and become more prominent. Can you explain the reasoning behind that?
The video that my dad took was quite distressing, and I can't believe it took for us to have a GP say that your mum's end of life for my mum for us to get an essential visits. And I took it part of a responsibility, actually, if you're part of a campaigning group and I have these contacts with these people, I felt like an obligation to say, like, look, this is somebody that wasn't getting essential visits. You think you've written a guidance, you've put it out there, you have to actually see if it's following through, you have to actually see if it's working. This isn't working, and I'm telling you this, and here's the evidence that I can show you from a personal point of view. And I felt like they had to know that, because I do think it can be quite, and I don't want to say this in a bad way, but it can be quite easy to write guidance and put it out there and think you've done your bit, but we have to make sure that that guidance is following through and actually working. And I felt like by doing that, I was showing them that something had to change again.
Mm-hmm. I'm not going to ask you about what you thought the terms of the guidance would be, because that's, I think, probably a fairly difficult question. Please don't take that as offensive. But I think one of the things points you're making here is that the manifestation of the guidance, how that was communicated, should have been better. You got any suggestions how that should have been done?
Well, I think every person that had a loved one in a care home should have known about essential visits from day one. And I don't think that was. I had to find out just because I put stuff on social media and someone I happened to know told me about it. So yeah, certainly something like that. And when guidance is put out, I think that it should be given to every somebody with a POA or guardianship should always be told about guidance that's there.
Again, looking at your feelings, paragraph 69, you say that you feel as if you had a moral responsibility to campaign for Anne's Law, and obviously you'd started that petition by this stage, and highlight the mistakes that were being made during the pandemic. And you then went from being presumably a relatively private individual to having a public persona. Was that comfortable for you?
No. No. I had to put my life out there just to try and see my mum, or for my mum to try and see someone. None of my friends were having to do that. They were just able to go and visit their mums. But I feel like I was forced. Yeah, okay, I didn't have to do the petition, but that was just something that I did one day when I was just having a really low moment about not what the situation was happening with my mum. But it's spiralled. I'll continue to do it. Like, for instance, like the other day, I walked into my daughter's playgroup, like, oh, I saw you on TV. Things like that. Like, so, like, people that I don't really share stuff with are now knowing stuff about me because I'm still having to do this. I will continue to do it, but that, as you're saying, is a big impact that I've had to really make myself more public than I would like to.
Paragraph 72 of your statement. I think we're talking about the arrangements for Christmas 2020.
Yeah.
And I think this is when the then First Minister said that country would be going into lockdown on Boxing Day, but that we could be in bubbles on Christmas Day. But as you say, if you had somebody in a care home, then you couldn't be in that bubble.
Yeah, the First Minister stood up, Parliament said that, create bubbles, but if you're visiting someone in a care home, I recommend you do not create a bubble. Didn't tell staff who are working in the care home that day, do not create a bubble, but particularly told if you're visiting someone in a care home, do not create a bubble. Again, highlighting the impact that was having on how families were feeling being locked out. Why were we being treated so differently to staff?
Now, you probably know this, Ms Hamilton, but did the First Minister make that distinction between the general public and those in care homes when she announced this?
The care home, the
bubbles.
The bubbles. That she stood up in Parliament and said that everybody can create bubbles. The country's more likely going to go down to lockdown on Boxing Day. Make sure it's just free people, free households, if I can remember correctly. But if you are, I can visualise it. If you are visiting someone in a care home, do not create a bubble.
Yeah, yeah. You conclude that paragraph 72 by saying the message about care homes from Nicola Sturgeon created fear.
Yeah, it just.
Could you just explain that?
It just emphasised, I think, the public persona that if you're dare to think you could visit someone in a care home, you're going to put the care home under risk of putting COVID in there. We had the First Minister was leading the country for this pandemic, standing up saying, do not do that, whereas we were trying to still fight to get in. But again, I'll reiterate it, she didn't tell staff to do it, so why are staff so different from the family members that want to go in on Christmas Day? And that, it speaks for itself, I think. Yeah.
Thank you. Yeah, go to paragraph 75, please. And can you just read that out, because I think it's a concluding comment by you on this these matters of visitation.
Many people say the guidance was there to protect care home residents. It didn't protect them. All the things that were put in place were not protecting my mum from her dementia symptoms worsening. My mum was in a care home because she had end-of-life dementia, not because of COVID. Things were not put in place for it. There is no cure for dementia. Everything was taken away from my mum. You wouldn't have taken away medication from someone. Yeah. I don't know if that meant to have something else in there, but yeah, you wouldn't have taken you wouldn't have taken medication away from someone that had an illness, but you took. So I think what I'm trying to say is you took away the her family who were able to try and keep her more active with her brain away from her.
Yeah. Now, I'm not going to ask you to go through the sections on infection control and PPE in any detail, subject to a little bit of clarification. At paragraph 79 of your statement, you talk about the first time that you got to see your mum by way of a garden visit. Mm-hmm. And you talk of humiliation. It was humiliating. Is that how you felt?
Yeah, and I think I touched on that earlier, sorry. So that was about, actually, now I think about it, I wasn't aware that a member of staff had to sit and watch me. Mm-hmm. And I think that's what I felt humiliated, that my first time seeing my mum, I wasn't trusted to be with her. Mm-hmm. Someone had to watch me, and that's again what I spoke about. I remember just wanting to leave, but because I was there with my dad, I had to support him, but also wanted to see my mum. But it was I vividly remember that feeling humiliated. I just wanted to remove myself from that situation, but I obviously wouldn't, because I wanted to see my mum and spend time with her.
And I think the final two sentences in paragraph 79, you talk about your biggest bugbear. I think I've actually counted, you've got two biggest bugbears. There's another one in your statement, but there's your biggest bugbear, you say. Well, just could you read those two sentences for me?
The biggest bugbear was that, is the difference with that, the member of staff who wheeled my mum out to me touching my mum, that member of staff was still able to go to their family and the shops or the pubs or the next day or on holiday, but don't you dare touch your mum.
Just to go towards concluding your evidence, Ms. Hamilton, inspections, which is at paragraphs 88 through to 90. You say that the Care Inspectorate should have been communicating government guidance for care homes, and you compare this to the advice for the general public. So just in relation to communication of government advice, what would you, as an affected person, what would you suggest? How should this be done?
Maybe care inspector's not the right person, but everyone that has someone in a care home, okay, 99% of everyone that has someone in a care home will have a family member or a close relative or somebody who's their advocate. Any sort of guidance going back from the essential visiting that was put in place in March 2020, why was that not then put? Like, the care homes would have known about that. Then there should be a moral responsibility to pass that on to the care home residents as well, because there's care home residents that have their full functions on them, so they should know their rights as well, and then passing that on to the families or the people who are the closest to them to know, again, the rights for those that maybe don't have their faculties about them. It felt like if you had someone in a care home, you had to fight, you had to read between the lines, you had to really go and look for it, but those working in the industry, they knew it all inside out. But it felt like it was hidden information that we're keeping this from you. You're not allowed to come in, but we're going to keep this information from you that might tell you how you could possibly get in.
Thank you. Just in relation to bereavement, you are complimentary of the care home in the way in which they handled your mother's death.
Yeah, there's obviously the run-up to it.
Yes.
But that's the guidance.
Yeah.
I could speak about that all day long.
Yeah.
But certainly when my mum passed away, they gave us all the time in the world to be there. Yeah, they helped me.
And you say that they were compassionate, the staff were compassionate.
Yeah, I've never once had a complaint about the care home or the care staff. It's the situation they were put in. Yeah.
And interestingly, you say in paragraph 93 that campaigning was your way of coping. Is it still your way of coping?
Yeah, so that's why I'm a bit of a contradiction when I say that I would give this up. I would give this up tomorrow, but
the impression you wouldn't.
Not until I've got ANS law put in place. No, and it's certainly been. I've blogged since Mum was diagnosed at age 56, and it's been some form of counselling. It's a way for me to get out how I'm coping with it. I would definitely, yeah.
Now, we've dealt with ANS law when you gave evidence, but I'd just like to take a couple of points that you've made in your statement. At paragraph 95, just about halfway down, just below halfway in that paragraph, you felt that the Petitions Committee did not grasp what was happening at grassroots. And once again, it felt like everything we were saying fell on deaf ears. Can you tell me why you felt that?
because it felt like there was guidance there, so everything should be fine. But we're the ones living it. We're the ones trying to fight for it. We're telling you that although there's guidance, it's not working. I got to a point where, like, do people think I'm enjoying just going to these meetings and shouting and making noise? No, if it was working, then you wouldn't be hearing from me. There's a reason why we've had to have petitions. There's a reason why families are having to do this. But it felt like we were the ones that weren't being listened to. We were the ones that weren't allowed in. We were the ones that weren't being listened to. Everybody that works in the industry gets a say, but we don't get a say. Nobody's listening to the realities of what we were living through, is what that felt like.
Mm-hmm. Right. You make the point in paragraph 96 that the party of government committed to Anne's Law in its manifesto. But what we have at the moment in the bill that we looked at last week is not Anne's Law as you understand it.
No, and again, the former First Minister stood up and said in September 2020, sorry, I can't remember the year, but that Anne's Law will be put in place to allow care home residents to have, care home relatives, to have access to the same way as staff do. That's not what's in place at the moment. So until that's what's in place, then we'll have to continue fighting for it.
Can I take you to paragraph 98 of your statement, which is problems with the pandemic response? Would you just read that through? Because I think that's, in many ways, a culmination of a lot of the things that you said.
So the biggest thing to me during the pandemic would be if my dad would have gotten, all I wanted was for Dad to see his wife and vice versa. I just needed to know Mum was okay. I was at home with my husband, I could see my pals, I could go for a walk. My mum was in that room, isolated from everyone who cared about her. Her life was torn to shreds. It hurt me more. It had a huge impact on my dad. There's a reason why I was welfare guardianship. Pre-COVID, I was aware that my mum was end of life. I feel like a baby wouldn't have been taken away from a parent in that context. My mum was very vulnerable and couldn't communicate her needs. People who knew my mum knew the cries, knew what made her happy. Another impact was that two grandchildren never got to see their gran. At a time in my mum's life when she was most vulnerable, she was separated from those who are most important to her. I feel she was discriminated against because of where she lived.
Ms Hamilton, thank you very much for giving evidence. We're very grateful to you.
Thank you.
Thank you.
Yes, thank you again, Ms Hamilton.
Good.
Break?
Another witness in 20 minutes?
Yes, by all means. So that's just on the half hour, just before the half hour. Very good, thank you, everybody. Right. Thank you. Now, Mr. Gale.
Thank you, my lord. Yes, the next witness is Campbell Duke.
Very good.
The reference is SCI WIT 0483,
Very
and
good.
then 5 zeros 1.
Yeah.
There isn't one under there, so it must be.
Now, good morning, Mr. Duke. Thank you very much indeed. Please be seated. Right. Mr. Gale, when you're ready.
Well, thank you. Morning, Mr. Duke.
Good morning.
Your full name is Campbell Duke, I think,
It is, yes.
and you're 68,
I am.
and your contact details are known to the inquiry, and you're a retired social worker,
Yeah.
as you say in paragraph 2 of your statement, and we'll come to a little more of that in due course. You're here to talk about your wife, Anne Duke, and we've heard this morning already from your daughter, Natasha Hamilton.
Yeah.
And so we already have your daughter's perspective on the care of her mother and on the circumstances of her death in the care home. You've provided the inquiry with a very detailed statement, which extends over 42 pages, 255 paragraphs, and in the time that we've got available, it will not be possible to read out all of that statement this morning. So what I intend to do is to ask you to concentrate on some of the matters that I think, from having read your statement, you are particularly anxious to get across to the inquiry. But please be assured that all of what you have said in the statement has been and will continue to be considered by the inquiry, and account will be taken of it. And I think also in an introduction, Mr. Duke, it is right to say that your love for and devotion to your late wife is very apparent from everything you say in your statement. And there is also the amount of detail that you've recorded incidents. And as you say at, I think it's paragraph 249 of your statement, you don't need to look at it. You've written a book in tribute to your wife, is that right?
Yes.
Yeah. And at a meeting I had with you a few weeks ago, the inquiry through me has indicated that we would wish to see and consider that book, and I think you're going to make that available to us.
Yeah.
Right. I think it's important that we get a little flavour of your late wife. So could you be shown, please, paragraphs 2, 3, 8, and following of your statement? I'm just taking a little time to come to that, so
Yeah.
we'll just wait until it's up on the screen. Right, I think we've got there. This is perhaps a summary on your part of your wife. I'm sure it's very difficult to convey in just a few paragraphs,
Yeah.
but you set out some information. Would you read, please, 238 down to 242, inclusive?
Anne was, for far too long, a mere statistic, a care home resident, an Alzheimer's sufferer, a COVID patient, a COVID survivor. On the 13th of November 2021, the system finally released its death grip on her beautiful soul and gave her back to her real family. Too little, too late. Once more a beautiful wife, a mother to 3 daughters and a son, a granny to 2 grandsons and 2 granddaughters, with 1 more grandchild on the way. Once more the young woman who personally nursed her own grandmother through her battle with Alzheimer's, and on her death, Anne was inconsolable with grief, just as we were at Anne's passing. She was the woman who painted sunflowers and was so good with her hands that she became the go-to for wedding decorations. She ran and organised a playgroup. She led a teenage girls group and taught little kiddies in Sunday school. She marched with thousands calling for social justice and an end to poverty. She danced stone-cold sober on tabletops, and her infectious laugh and love of life was a thing of joy. Ironically, she worked many years as a carer in care homes. Often she came home teary-eyed from a night shift to sadly announce that wee Aggie had died during the night.
Yeah. Can you read also 242, please?
As ill health overtook her and petty bureaucracy wrapped her in its arrogant duty of care, they robbed her of her unique beauty, her individuality. They stole her from us, and it remains unforgivable. There was always somebody who knew best and what procedures to follow, but precious few who loved her.
Right, well, thank you for that. And I appreciate a very brief summary of your wife. I'm sure it can't do justice to her, but thank you for giving us that. Now, well, I'll give the team behind me a chance to go back to the start of the statement, but I'll just take you through some matters without actually having to look at the context. She was your wife for 36 years.
Yes.
You had 4 children,
Yep.
3 daughters and a son. Mm-hmm. And until she went into care in 2018, she lived at home with you and you cared for her, together with your other family members?
Together with family and friends.
Yeah.
Yeah.
Yeah. And we know from your statement, it's paragraph 20 for the reference, and from the evidence of your daughter that we've heard, that your wife was diagnosed with early onset dementia in 2014.
Yeah.
And although I think you say that she had displayed some worrying symptoms prior to that.
Yes.
And I think at paragraph 22 of your statement, you say that notwithstanding the effects of the disease, she was cognizant of who you were and mostly amenable to your love and care.
Yeah.
And I take it you were able to understand from your knowledge of her the reactions that she had to you.
I think obviously we're going into the realm of Alzheimer's disease, which has its own peculiarities. I operated from the point of view that, first of all, being her husband of 36 years, that there was a lot there that the average person did not see. And I think it was too lazy an assumption by too many people that because she had Alzheimer's, then her cognitive abilities were so severely reduced that it really didn't matter what happened to her. And I think that had implications for the future in terms of the lockdown.
Right. Now, I think you remained in employment, at least for a while your wife had Alzheimer's in early stages. You continued to work, and you would devote your evenings and weekends to caring for her, and other members of your family would care for her at other times.
Yeah.
So effectively, she was given, within her home, 24-hour care.
She was given 24-hour care because that's what the medical board wanted, and we, certainly as a family, gave her that 24-hour care. We did, in fairness, receive 30 hours per week from the social care system, but there are, of course, 168 hours in the week, so we did the other 138 hours. Yeah. Well, certainly the lion's share.
Yeah. And we are aware, Mr. Duke, from what you say in your statement, that your wife's move into a care home was not something that you wanted.
No, nobody in the family wanted it to happen, and I would remain convinced to this day that it didn't have to happen, but it did.
Yeah, and I think we can read your reasoning for that, and we understand your reasoning for that. So, can we move on in your statement to paragraph 32, please, which relates to the period pre-pandemic of your wife's care. And summarizing, if I may, it does appear that you and your family became an essential part of the care that was given to your wife in the home.
Yes.
That's the care home, not your
Yes,
yeah. And as you say at paragraph 32, you would be with her for 4 to 5 hours per day.
Yeah.
And you also say that her basic care needs were, by and large, normally well catered for.
Yes. Yeah.
And again, we've heard this from your daughter, but the understanding is, and you say it in paragraph 34, that you say it in the general terms of a resident with a supportive family was of genuine value to the staff, but you clearly were.
Yeah.
And you appreciated that, and the staff appreciated that.
I hope so. We did.
Yeah.
I think they did too, yeah.
Okay. Right. If we could just look at paragraph 40, please. Because, again, reminding ourselves that this is pre-pandemic. What you say in the final sentence of paragraph 40 is that the carers within the care home never once said, no, you have to go, it's regulations. They just said, that's great and thanks. So there was never any sort of, you can put it this way, clock watching of you in the care home, never any suggestion that you'd perhaps overstayed your welcome.
Not as such, no. There was a general give and take in that respect. Obviously, if I wanted to stay till midnight, I would probably have raised a few eyebrows, but I could be there from about 8 o'clock in the morning if I chose, sometimes up till 9 o'clock or 10 o'clock at night. Mm-hmm. And always at that point, you were fulfilling some function, even if it was simply being with Anne and thereby allowing staff to do something else. So it was a good teamwork.
Mm-hmm. Yeah. It may seem a blindingly obvious question to you, Mr. Duke, but why did you want to spend so much time with her?
Because I loved her. She was my wife. I can only give the blindingly obvious answer to that, but I appreciate the question.
Yeah. And I think also probably because you would know her and have an appreciation of the subtle signs that she could give to you.
Yes, and there was plenty of evidence of that. And even if it was only me that was reading those signs, it didn't matter. She was responding to me and I could respond to her in a way that only couples could understand. And many of us here in this room would understand that.
And I think you summarise this really in paragraphs 41 and 42, where you say you were only too happy to help. And then in paragraph 42, you say, we were not just there as visitors. We were with Anne. We were a vital part of her care team.
Yeah.
That was your perception.
That was my perception, also based historically on the fact that until the point when she came into the care home, we were the care team, and therefore we felt it was very important that our contribution be recognised as being vital. And in many ways, we saw the care home as an adjunct to the care we'd already been providing. Mm-hmm. It wasn't something we had wanted as such, but given that it was there, we were prepared to enter into a new negotiation with them and work as a team to continue to care for Anne in the same way as we had been caring for her.
Yeah. You call it an adjunct. Perhaps another way of describing it, so far as you were attempting to do, would be to see it as a continuum of the level of care that she was receiving at home.
Yes.
Yeah. Okay. Right. Could you go back to paragraph 36, please, within the statement? And again, we touched on this slightly with your daughter earlier this morning. But you tell us there some of the things that you could do with and for Anne. Mm-hmm. And I think we see she required, as you put it, direct, personal, intimate experience.
Yes.
And she also needed touched, cuddled, embraced, whispered to, and to be engaged in eye contact.
Yeah.
And you say she responded to that, and you, as you put it, we had a continuing meaningful relationship, given that she had such a significant illness. Well, we've heard already in the inquiry, Mr. Duke, of the importance of sensory contact for dementia sufferers. So you can take it for granted that we are aware of that. It's not something that comes as a surprise or seems slightly unusual. We're aware of that. Sorry, I lost my place. Could you go to paragraph 48, please? You put it there, and this is just pre-pandemic, December 2019. Apart from the dreadful scourge of Alzheimer's that continued to exact its dreadful toll, we had reached an accommodation with Anne's reality, and we were working in tandem with the care staff. Can you just explain to us what you mean by an accommodation with Anne's reality?
I think I'd go back to the word that you used, continuum, and that Anne was still the same Anne that was living with me before she entered into the care home, but she changed because of the Alzheimer's. If circumstances, for whatever reason, dictated that she ended up in a care home, it was still the same Anne, and therefore we continued to work. And as a family, we were looking at how the care home was an extension of the things that we had been doing. There was nothing, with all due respect to the care home, that they were doing for Anne that we had not been doing a whole range of her life. Continence care, feeding, washing, recreational. We were doing that before she went into the care home. There was nothing exceptionally different that the care home were doing for Anne that we had not been capable of doing. It was just a different location.
Thank you. Can we move on to the events of and after March 2020? And can we go to paragraph 52, please? And I think you say there what confronted you on the 13th of March 2020, when you found the door to the care home locked, well, both doors to the care home locked, and eventually somebody came out to see you, and that person said to you, you can't come in, we're in quarantine, no one's allowed in.
Yeah.
Obviously, there had been some widespread awareness of the impact of the virus prior to that. Was that situation that confronted you on the 13th of March a surprise to you?
It was. Yeah. Not in the sense of there was a virus stalking the land, but finding the door locked was my first understanding that matters had got serious within the care home.
And you weren't alerted to that in advance?
Not to that particular issue, no. I went in the full expectation of being able to visit that night.
And paragraph 54, you say that you were informed that they were in lockdown,
Yeah.
and that if they let me in, you would spread the virus and they would be sued. Is that what you were actually told?
Yes.
That's not an impression that you got from
No,
what
it's
you
not
were
an
told?
impression. No, it's a fairly accurate rendition of what I was told. I remember it distinctly. It wasn't the last time that something like that nature would be said.
And I think you go on to say that this was not untypical of the superficial, though certainly stigmatizing attitudes towards relatives that almost immediately took root.
Yeah.
So that was something that continued in your experience.
I think it did throughout the duration of the lockdown from the top down. There was a simple message that they seemed to be giving that we have a serious situation here. We will fix it by banning the relatives. Sorted.
Paragraph 55, you indicate that it was 7 months from the 13th of March to the 29th of October of 2020 that you were not allowed back into the care home.
Yeah.
And as I understand it, and again, it's something that your daughter has also spoken to, in that period, the onus was on you to contact the home to obtain information about your wife.
Yes.
Yeah. And if you go to paragraph 58, please. Well, perhaps just taking what well, no, it is 58. You give the impression there that there was an almost stereotypical conversation between you and the care home, which would end with you making, well, which would begin with you making an inquiry as to your wife's condition and health and general well-being, and you would simply be told that she was fine.
Fine was the operative word.
And what were you? What would you have liked to have been told? What amount of detail would you have liked to have been told about your wife during that period?
I mean, we were aware that the care home staff were under a great deal of pressure, but the word fine seemed insufficient. I wasn't necessarily expecting a full bulletin, but perhaps some description of what she'd done with her day. How was her health in general? Because she wasn't simply being secluded from coronavirus. She was a woman who was in a care home because she had Alzheimer's disease, and that continued to work its way through her, notwithstanding the virus, and therefore we were still keen to know how she was coping with Alzheimer's. Was she generally okay? Was she being given one-to-one time? Or was she spending the bulk of her time, which was our fear, on her own, which was just a dreadful thought.
That would presumably be a fear for you as well.
A huge fear. The guidelines from ScotGov guidelines at the time from March and May were making it quite clear that they were encouraging the care homes to seclude care home residents in their rooms. And I could kind of understand the reason for that. But for somebody who was really needing intimate contact and touch, the concept of her being stuck in her room with maybe the Alexa on turned up loud, perhaps, was unthinkable, but was quite probably happening, and I'm not meaning that as a criticism of the care home staff. There were not enough of them to give Anne the 45 hours a day that I had been giving her, and other relatives and friends as well. So it was a worry.
Yeah, I think you say in paragraph 59 that this situation was, in your view, highly unsatisfactory.
I think it was absolutely unsatisfactory. Yeah.
Now, during this time, obviously, you were not aware of what was happening within the care home so far as your wife was concerned. But you knew, as you say in paragraph 61, that how this would impact on her cognitive activities and overall health.
Yeah.
Now, you've told us at the beginning of your evidence that you are a retired social worker. Were you able to bring to bear any of your knowledge and experience as a social worker to the situation that you knew your wife was, or what you knew your wife was likely in?
I tried not to, because it wasn't a specialty of mine, but yeah, I mean, I was aware of it from some of my training, some of my work. I was anxious to explain to the care home that I was the anxious husband. That was my specialty. But we were aware, and even if we had not been aware, I think the other thing that the care industry, the care home industry needed to start understanding much quicker was that the relatives as a group around the country were a good cross-section of society with a lot of professional experience, and if not, access to the internet. And we were fast becoming a group of people who were cluing up on coronavirus and how it might affect and impact on people's mental health. So we knew that there were serious risks, and everybody knew that there were serious risks. And again, I go back to the ScotGov guidelines that were issued in March and May in particular, were saying to the care homes, there will be a risk to your residents' mental health, and you should be looking at individual needs-led assessments to perhaps even at that early stage determine the need for essential visitors, but it never happened.
As I said to your daughter a little while ago, we're obviously looking at the impacts that the pandemic had on your wife, but we're also looking at the impacts it had on you as a wider family. Yeah. And some of the reactions that you had. And if you go to paragraph 68, you indicate there that you could have insisted that you stayed, and you say that you were pretty certain that if you'd done that, the police would have been called. And you then go, I'm sorry, that's in 67, you go on to 68, and you say that you did not wish to offend the staff. If you had caused a scene, I'm sure the care home manager would have decided, even in these extreme circumstances, I would not be allowed back to see Anne, and it would have been counterproductive. And you say, yet I still feel the guilt, and it will never go.
Yeah.
Just tell me about the guilt you feel.
I suppose a natural instinct, if I just talk about, a couple, a man and a woman, love each other deeply. If I'd been out somewhere and a speeding truck was to come towards my wife, I might be inclined to jump in its path to protect her. I don't want to sound overly dramatic. The urge to care for and protect somebody that you love is so powerful that I'm sure everybody in this room and elsewhere will understand. And yet you found yourself having to be very wary of stepping in because there was this power imbalance between the family and the care home. What had hitherto been a reasonably good working relationship suddenly became one that was fraught with difficulties. I couldn't be sure that if I was to second guess the staff and perhaps make a nuisance of myself by every second day phoning the manager to say blah, 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 then the staff would inevitably, I think, in all fairness to them, become a bit wary of me. And indeed, if I had been forced in the issue and said I'm not leaving, I understand that probably officers of the law may have been required to come and remove me from the building, and it wouldn't have gone down well. In other words, I was learning quickly that we had to learn to be compliant.
Yeah.
That didn't help me, and it certainly didn't help Anne, but it made sure the regulations, as dictated from on high, were able to operate easily because we all obeyed them.
Paragraph 69 of your statement, you set out a long quotation from a letter that was sent from your wife's GP, which you received. And we've heard about that from your daughter, and she quoted part of that. So we've got that quotation. But you take the matter on a little more in that you go on to talk about DNR. And that, as I understand what you say in your statement, you saw that letter as almost an implied requirement that you should, in relation to your wife, agree to DNR.
I think it was very subtly put, but the implication was there. And I think if you weren't totally aware of the situation, or indeed what a DNR really was, or if we hadn't been aware of the fact that we as a family had had a meeting with staff previously and had made it quite clear in framing an anticipatory care plan, we did not and would not consent to signing DNRs. Therefore, it being requested again in a letter, which I think is the one that uses various other comments, such as, it will result in a number of deaths.
Yeah.
That was quite a heavy, emotional statement to come from the GP. Now, I understand it may have been telling it like it was, but there was nevertheless a lot of weight behind that and saying bad things are going to happen. Here's the best way to handle it. And we were saying, but we've already decided we don't want to do it that way. Mm-hmm. And so we had to ignore that subtle, I think it might be subtle, but maybe not so subtle pressure to sign a DNR.
That's certainly what you implied from it.
Yes, that's certainly what we took from it, yeah.
Mm-hmm. Mm-hmm. And I think, interestingly, you've told us that there had previously been discussions about DNR in relation to
yes,
your wife.
As I was saying, when we framed an anticipatory care plan looking to future needs for my wife, it included such matters as, would you be prepared to sign a DNR? We discussed that with the nurse. Natasha, my daughter, was there too, myself, and we said, no, we don't.
Yeah. Yeah. So you resisted, and that remained your position in relation to your wife?
It did, yes. We sent a letter back saying that we will not consent to signing a DNR. If we have to have some decision taken that my wife can no longer be treated, we would prefer it to be from a doctor in a hospital setting when all else had been tried, rather than my fear was it was going to become a default position, meaning that amongst many other people in the care home, you then had a care home which was full of people who had signed DNRs and almost de facto would no longer be considered necessary for them to go to hospital, even if medically it might have been a good idea.
You go on to tell us that on the 10th of April, this is paragraph 74, you discovered through social media that there was a COVID outbreak in Anne's care home. And I think you were told that that was COVID downstairs.
Yeah.
I think your wife was upstairs in the care home.
Yeah.
And I think you were told that nobody in her unit had COVID.
Yes.
However, thereafter there was some concern about your wife's condition. And there was, due to her blood sats, which were at 92%, there was a proposal that she be admitted to hospital as a precautionary measure. But that, in fact, didn't happen, I don't think.
No.
And I think she was... Was that the occasion on which she did get into an ambulance and the paramedics took the view that it wasn't necessary?
It was the care home on the 13th of April that had called for an ambulance to attend at the care home because of the blood sats being low. And our difficulty was that we were, of course, behind the curve on the wrong side of the telephone after the event, so to speak. Yeah. And we were only hearing about whatever discussions took place between care home staff and the attending ambulance crew, who no doubt were also speaking to some doctors at the hospital. The end product was they decided that my wife would not be admitted to hospital that day. We are never sure to this day yet whether that was because she was no longer medically needing to be taken into hospital. That can happen, even though somebody had called for the ambulance. Or, well, I mean, our fear, we were talking about, this is my lived experience, so our fear was that there some kind of subtle decision that, well, it's somebody who's frail and living in a care home and maybe didn't merit, if they were triaging for some other reason at the hospital, didn't come up high on the list of priorities for hospitalisation, therefore she stayed in the care home. And, you know, we could not be sure. We don't think the care home could properly answer that question. We never did quite get to know exactly why she wasn't taken to hospital.
And I think in paragraph 78 you quote from an email that you sent to the care home about this matter. Perhaps you just read that, the terms of that email, please.
I emailed the care home saying, regarding Anne Duke, you will be aware we have been advised today that Anne has been refused hospital admission despite there being concerns re her oxygen sats. We greatly appreciate the nurse who has updated us. However, we feel it is unfair on her to have to deal with patient care and liaise with families at such a difficult time. We have not been approached by any medical doctor, and this decision seems to have been taken without the courtesy of consulting with Mrs. Duke's family. Is there a member of your team who can give us more detailed feedback today? Thank you. I did not, so there was one final sentence there, I did not receive any feedback from management, though I think it was at the weekend, and bizarrely they did not work at the weekends.
Yeah. Did you ever get a satisfactory explanation of that, or response to that?
No. Now, in fairness to the care home, we probably didn't pursue it. You know, we come back to the guilt thing again, because we didn't want to keep pushing that issue, but we had made it clear to them, if she falls ill again, we really do expect her to be taken to hospital unless somebody can speak to us directly and give us a medical reason why it was not indicated.
You do make a suggestion in relation to this, in relation to communication, in paragraph 80 of your statement. You say, I feel I think the care home, should have had an additional seconded member of staff to coordinate such matters. They could be in the room noting the circumstances and they could feed back to the family. Yeah. I appreciate if there was a nurse on floor dealing with a crisis and somebody buzzes because they need to go to that toilet, then that cannot happen. Staff must have been under constant pressure. Yeah. And I think you appreciate the pressure that staff were under.
We knew the pressure the staff would be under because we had been living with and working with them for 2.5 to 3 years before the pandemic struck. And to the best of my understanding, there had been no change in their staff numbers. So they lost all the input, the valuable input from families. They were dealing with all the extra precautions and risks associated with COVID, and they simply would not have had the time to do that. And I wondered why perhaps the government, there seemed to be a lot of money for furloughing, etc., and why the government could not perhaps have given some money to care homes to employ some extra staff. My understanding was none of that happened in care homes.
Now, going on to paragraph 88, and on the 17th of April, your wife tested positive for COVID.
Yeah.
And you were subsequently informed that she had been admitted to hospital on, I think, the 24th.
Yeah.
And again, perhaps I'm an expert on the blindingly obvious questions, Mr. Duke, but I apologise for that. That must have been a very worrying period for you.
I mean, it was. We were aware that it was a global pandemic. In that sense, we were not unique. And yet, my relationship with my wife is unique. And therefore, I felt quite entitled to be terribly worried about it, as I should have been. It was very, very hard. It was that same instinct that I mentioned earlier, where under normal circumstances, your wife is taken seriously ill and rushed to hospital. What do? We rush to hospital. Instead, we are told, stay where you are. And I appreciate that was happening to everybody, but it doesn't lessen the fact that it was a dreadful experience to have to undergo. And we had to consult over the telephone, and usually again after the fact. And we were just catching up and always just worrying that she could be dead before we make the next phone call.
What was the level of communication you received about her condition during that period?
From the hospital?
Yes.
Not much better than was given by the care home, but the hospital appeared to have more time for us when we phoned them. So she was in hospital for 14 days, and we quickly developed a routine of phoning 3 times a day. We divvied it up between children and me, and phoned morning, afternoon and evening. And we usually got just a bit more information. She was on oxygen, antibiotics, and IV fluids. And they would explain to us how she'd been during the day. And certainly we got more information from the hospital than we often did from the care home. But it remained the case, understandably, we weren't allowed to go see her. So, as in a situation where she nearly died, on the evening she was taken into the hospital, the doctor had told me, be prepared for bad news, which I took to mean, your wife is going to die, because they had said to me, we will not intubate, we will not take her into intensive care, she's too frail. And so I certainly expected her. All the evidence that I had before me was saying, Anne is going to die tonight. And so you find yourself sitting at home with your mobile phone, praying that it doesn't ring, and fearful that it would.
Yes, understand that. Eventually, you did receive some heartening news.
Yes.
And after 2 weeks, your wife was well enough to return to the care home.
Yeah.
And when she got back to the care home, as you say in paragraph 95, she had to be isolated and barrier nursed for a further 14 days.
Yeah.
You weren't given an indication that she was in advance going to be returned to the care home. In fact, it was the care home that got in touch with you to tell you that.
I think it was generally the case that we only found out about things afterwards. So we weren't sure when she was going to be returned to the home. I should mention, I think it's worth mentioning, if it's all right with yourself, it seems like a slip of the tongue. It doesn't seem too important. For me, it was a terribly important thing. The care home manager said once she'd been able to announce to me that Anne was back, she said, it's so good to have her home, which rather stung, because it was this taking over the concept of family that permeated throughout, again, I think, the social care industry. I think it was used as a fig leaf for what other things may have been going on by simply trying to persuade us that the care home was an adequate substitute for a lifelong of family and kinship. And so they quickly fell into using that kind of language. And so it may seem a slight matter. I think to us as family, we were saying, oh, we are the family. And you need to recognise our role in this woman's life.
It's probably fair to say that that probably wasn't meant as an insult to you or a slight on you.
No,
but it was just the way it was put.
Well, yes, but it became an unconscious belief within the care home system that we are their family. And I think the average care worker meant well by that. I think I've maybe said elsewhere, or we may come to it, my wife was a carer in care homes.
Yes.
I feel well qualified to speak about that in that sense. But they were not her family. We were her family, and therefore even an unconscious use of that kind of language, yeah, I guess we were a bit sensitive, but that's how it felt.
Okay. Paragraph 100. You mentioned that there was no allowance for creative management. I just understand what you're saying there.
To the best of my knowledge, all that happened on March the 13th in terms of what was going on inside care homes to minimise the risk. I know there were some other issues for the care staff in terms of using PPE, etc., but it certainly weighed heavily in our minds that the notion of banning the relatives seemed to have fixed everything. But not much else had been attempted beyond that. And I was reading in newspaper reports about the English Cricket Board had a big international test match going on, and they had invented all sorts of systems using plexiglass, creative use of rooms, and they were cohorting. Different players would move in different directions, and I wasn't aware of any such imaginative thinking going into what was going on inside a care home, and certainly nobody in the care home ever gave us to understand that that was the case. They simply had made sure that we were not allowed in because we would. And I need to stress that again, it wasn't about you might, you will bring in the virus and you will be the cause of death. And yet the virus did get into the care homes, and it wasn't the relatives that did that. And so we wondered why there couldn't have been more imaginative use. Cohorting, the pressure on people to sign DNRs, perhaps those who all wanted to live with DNRs could have been sectioned off. It was a big care home. Some smaller ones couldn't do that, and they could run that risk. And those who were wanting to have their relatives come in could have been in a different part of the building, and some kind of imaginative system to allow some people in, bearing in mind that not every care home resident, sadly, receives visitors anyway, so it's not as if the care home was going to be inundated with visits.
Okay. Thank you. We take you on to your section in your statement on treatment and care of residents. And again, a lot of the factual background to this we have from your statement and also from your daughter's statement and the background in that statement. So we are aware of the situation. But I'd like to pick up a couple of points, if I may. Paragraph 105. This is you talking about the fact that you were aware that your wife had lost weight. Although, again, that was something you found out ex post facto.
Yeah.
In conversation, as you say. You were never given much information. There were no doctor's letters. And you go on to say, I do not believe people realize how far out of the loop we were as family.
Yeah.
Again, can you explain that a little bit, in a little bit more detail?
I think the general population did not really understand that simply by saying that we were not allowed into the building, it meant so much more than that. And it was almost like if the government diktat from on high had said, we will ban the relatives, then it allowed the care home industry to adopt a whole set of other measures which, in a sense, were punitive towards the families, so that if we weren't allowed in the building, it wasn't so tellingly necessary for us to know about how my wife's health was doing, because those who were in situ were the ones that were dealing with her. And as long as they knew how she was coping and managing, then there wasn't an overwhelming need for them to keep telling the family and keep them up to date. We were simply erased from the picture. And I think it was probably unintentional, but it was nevertheless a direct, what I call an unintended consequence of that whole ethos that went through the whole system.
Yeah, just on unintended consequences, because that's something you mention in paragraph 106, but I think you mention it in a rather more general way, because you preface what you say is by saying, I cannot believe that the officials who instituted the bans on care home relatives, ever seriously contemplated the unintended consequences.
Yeah.
Now, just stopping there, firstly, how have you formed that belief? And perhaps you can give some more indications of what you see as the unintended consequences.
I think the unintended consequences came, it's also through the entirety of my witness statement and also through the entirety of our experience. It may be all right under any circumstance for any system to plan at a high level, governmental level, HQ, that this should be the case. But as it works its way down the system, what happened was that in the care home staff, care home manager, the families, albeit excluded from being inside the building, had to try and make sense of that. This probably became more apparent once we were finally allowed back in, but it became the case that, well, why do we need to tell the families? Where did that doctor's letter go from the hospital? Well, it obviously goes to the place where the person is going to, and she wasn't going back to my house or our house. She was going back to the care home. Therefore, the doctor's letter with all the attendant information went to the care home, which may have included references to weight loss, etc., but it wasn't something that we needed to know directly because we weren't dealing with her on a day-by-day basis. And therefore, these are some of the examples that became even more bizarre and complex when they were finally letting us into the building. But I think that was part of it, just that this notion that ban the relatives and that fixes everything. You couldn't unban the relatives in the sense that you could stop us getting into the building, but you couldn't stop us caring and loving for our relatives. It's a powerful urge that we all understand, I'm sure.
I think you reflect in that paragraph one of the competing issues that the inquiry is aware of in our work so far, and we will continue to be aware of. Whereas you say the system gave the care homes carte blanche. They could ban the relatives. They could by implication ignore them. And you go on to say powers of attorney and guardianship rights were overturned by the COVID legislation.
That is my understanding. I wasn't aware of it at the time, but also people more expert in these matters would know, but I believe the Parliament passed the Coronavirus Act,
yes,
which most of us only heard about in passing, but a powerful set of laws or powers that were then given to the care home to be able to protect us. And I think, as my daughter once said, they knew what they were trying to protect and from, but they never seemed to understand what they were protecting her for.
Okay. Again, that paragraph is, if I may say, quite a significant paragraph in your statement, Mr. Duke, because you conclude by saying the care home residents were one of the few sectors of society whose obedience to the laws was seriously policed and was literally under lock and key.
Yeah.
Right.
I think that's an important point that she was, I can't stress this enough, she was under lock and key. I know that the majority of us in the population were expected to obey COVID regulations, but much of it was taken as given. We were trusted to behave ourselves. And if your elderly relative was shielding in their flat somewhere in town, you shouldn't be going to see them. But we know from the trouble they had with the R number in the general population that many people in the society were bending the rules. I don't need to have much evidence to suggest that may have been the case.
Or just disobeying them.
Disobeying them, because you could go and see your granny if she was living in her own house, even although the regulation said don't go see her. We simply could not do that. We were one of the few, well, not we, my wife was one of the few sectors of society who literally had somebody standing at their front door with the keys saying, you will not pass.
Can we go on to paragraph 110 of your statement, please? And I just want to get the context of this right, because it may give a slightly false impression. And I just want to understand that what you are actually saying. You refer to the, as it were, the projection of care staff as a band of angels who are risking their lives for the benefit of residents. But as I read what you say, and particularly what you say in paragraph 111, I don't think you're being critical of the staff. What you're criticizing is, as I understand it, the image projected by the industry and government. Is that right?
Yeah, if I was a PR representative for the government, one of the best wizard ideas I could have come up with was presenting care home staff as a group of angels. And I stress this again, as the husband of a carer, I feel well enough qualified to talk. I lived with a carer, with an angel. She was not necessarily always an angel, she was just a human being. The government, I think, were using it as a fig leaf and saying, these are people who are going above and beyond the call of duty, and it was very much then inclined to make us, as the relatives, back off from being too critical. And yet it was the interface between us and these carers where we had to live, and it was very difficult, because if we looked as if we were being critical, then it could look bad. But I think it was that the carers were being played by the government as much as the families were.
Yeah. And I think you set that out in paragraph 111, where you say that put unfair and unrealistic pressure on staff and families.
Yeah.
It wasn't just the families that were adversely impacted by that.
No.
Okay.
If it's fair to say, could we alluded to the fact that we quickly became very attuned, and with the wonders of the modern internet, etc., we, as a group of families, became very, very knowledgeable about what was going on. And I certainly was coming across comments and statements made by other agencies. One national agency was often talking about the pressure on care home staff, talking about them leaving the job or phoning in sick, not just because of COVID, talking about staff having suicidal ideation. These poor people were put under tremendous pressure, and also by implication, if that was the case, that these people were feeling that way, then by that same measure, they were incapable of providing adequate care for our families. Not because there was anything intrinsically wrong with them, but because they were caught up in a situation that was always doomed to have more problems than it was worth.
Right, can we go on to visitation, please? Because you deal with this over several paragraphs, and there's just one or two points I'd like to extract from what you say in relation to visitation. First of all, at paragraph 119, you talk about, you've talked about window visits and garden visits. If one has the perception of a garden visit as sitting in a nice lawned area with rosebuds over the arches and a gazebo at the end of it, that wasn't really what it was like, was it?
Well, obviously I can only speak to my experience, but I'm sure it was probably replicated throughout the country. No, our garden visits were taking place in a car park with potholes in it, 15 feet away from the pavement where people were passing by. And, you know, my wife is brought out to be paraded and sat 2 to 3 metres away from me with a member of staff sitting, watching, listening to everything. It was cold. Scottish summer, August, September, so it was cold anyway. And Anne had not been outside, therefore she was wrapped up, woolen hat, scarf, gloves, big jacket, a tartan rug over her. It was hard to see her sometimes, and you could just about see her face. And in any case, I was having to shout at her from 3 metres away, "I love you." Try doing that in public. Not a terribly satisfactory experience.
I think you make the point, your daughter made the point of lack of privacy in these situations.
Absolutely. I mean, seriously, people were walking by 10, 15 feet away. They could see us, they could hear us, they knew what was going on. There's that guy visiting his wife. It wasn't private at all.
Yeah. And I think you also indicate that on a number of occasions, visits were cancelled, because obviously you had to arrange these visits in advance. And they would often be cancelled because, sometimes probably for weather reasons, and also on occasions because of your wife's condition. I think on a number of occasions you say that she was sleepy, or we're told she was sleepy.
Yes, I know. One always has to take these things at face value, but the longer you are kept out of the loop, you cannot help, we're all human, you cannot help but start to be a bit suspicious. And in fact, I think we had grounds for that being justifiable suspicion at some point, which we may discuss.
Paragraph 123, and this may be leading on to that, Mr. Duke. Last sentence, you reiterated a request, this is in June, that had been previously made for some form of comprehensive assessment of Anne's mental and emotional health. Yeah. Why did you ask for that, and did you ever get it?
Okay, we asked for it because we just were concerned in general about her state of health, and we weren't sure what her state of health was. I have to apologise to the inquiry. That's been omitted from my witness statement. We did eventually get some form of a response from the care home, which was essentially that the care home manager had decided that Anne's mental health was fine. So this wasn't an assessment by a mental health practitioner. It seemed that the care home were judge, jury and executioner in these matters. And again, we could have probably taken it further, but one again was always trying to be amenable, understanding, and not push too far for fear of souring the relationship. But so we didn't get a proper response or an adequate response.
Mm-hmm. Yeah, can I take you to paragraphs 129 and 130 of your statement, please? And you mentioned there in August 2020, the government published care home residents will be able to receive more outdoor visits from Monday, the 10th of August. And this was a quote attributed to Jean Freeman, the health secretary. And it also stated that indoor visits would be introduced as of the 24th of August, providing necessary criteria were met. You then received, after the issuing of that advice, an email from the home saying, quote, we have discussed this with Public Health this morning, who advised that they were unaware that these changes were occurring. As it stands, garden visits remain the same. What was your reaction to that? Well, I think you tell us in the next sentence.
Very frustrated, yeah. This was not untypical, and again, this is what I refer to as the unintended consequences. Somebody at a high level was saying, let it be this way. It works its way through the system, and it started to become quite apparent that public health were often flying under the radar and were like the powers behind the throne, as it were, and the government could say one thing, but if public health said something else, then it often seemed to us that the care home would use that as their yardstick for deciding what to do. And I can understand to a certain extent where that was coming from. Public health were keeping a close eye on the R number, and obviously that if that was changing and going in the wrong direction, then public health would err on the side of caution and say, well, it's all very well for the government, I'm paraphrasing here, all very well for the government to say we'll open up to more visits, but we say otherwise.
Okay. Paragraph 134, you describe a garden visit which occurred on the 21st of August 2020, and we can read what you say there, but there were, as you saw it, and one can understand it, lots of unsatisfactory aspects to that visit, and some of which I think involved the fact that there was a staff member who was able to be close to Anne. You obviously couldn't be, and there were other people who were able to walk past. And I think you made a complaint about that, and you got a response from the care home on the 15th of September of that year saying it wouldn't happen again, and that staff had been better trained. So did you feel you had actually made some progress on that matter?
Temporarily. It happened again 1 year later.
And you describe window visits as you put it, a comedy of errors. Okay. I think we'll just continue. We're just thinking of the time for the, should we just continue to? Are you okay, Mr.
Continue on towards 1 o'clock if you want, Jeff.
Yes, if you don't mind, my lord.
I think that's
we'll
sensible.
do that. I think we can get Mr. Duke's evidence finished before 1 o'clock. Right. A comedy of errors. Again, I think we can see there, if you give one example of that, that on a particular occasion the sun was shining, so you couldn't see your wife.
No.
And there was also occasions when she was moved to a different room, but because of the slope in the grass, the window was more than 5 feet above ground level, meaning that all Anne could see was your head.
Yes.
Okay. We move on to paragraph 140, 141, please. Again, here you are indicating that you'd received an email from the care home stating that they'd received a letter from Public Health that internal visits will not proceed due to cases and clusters and local prevalence. And you sent an email to Public Health seeking clarification. However, you do not receive a reply.
No.
And you go on to say in 141, care home residents were not obtaining new freedoms yet because the R number had spiked as the general population could not seemingly behave themselves. Is that how you felt?
It may be a bit pejorative, but I'm not really sure what other sort of connotation I could put on that. But it certainly seemed the case, as we knew there were all sorts of issues, but it seemed that if the R number wasn't coming in the right direction, Public Health were, really desperately trying to figure out what to do about that. But the one thing they knew they could do was continue to maintain the ban on relatives getting into care homes. And it never seemed to make much sense to us as families. And nobody ever really tried to explain the science behind that. They just banned us.
And I think you conclude that paragraph by saying they effectively sanctioned the care home residents for others' misbehaviour. It felt harsh and punitive.
Yes, I mean, the care home residents were not misbehaving. They were not bending the rules. If the R number wasn't behaving itself, it must have been because the general population wasn't doing the right thing or listening to the instructions properly. But the one group of people that were clearly impacted by that were the care home residents whose situation was maintained by this strict ban, and that seemed terribly unfair.
Yeah, can we move on to paragraphs 147 and 148, please? You talk about a visit that you had on the 4th of October on the outside looking in, as you put it. And you then indicate that on your side of the divide it was cold and wet and dark, and you still struggle with how the world seems so easily disposed to dismiss the intense instinctual urge to touch or hug.
Yeah.
That was clearly, obviously, something you found difficult.
It was terribly difficult. You know, again, the common perception was that these euphemistically styled window and garden visits were beautiful moments, and they were not. They were dreadfully difficult and really just underscored the fact that you were separated from your loved one. It could have been anybody else. I'm talking about myself and my wife. And the nonsensical way that these things were operating. It sounded lovely, but it was dreadfully difficult to organise for the care home staff and for the families, and not least for the residents. If my wife was brought to a window inside and she's feeling a bit tired or sleepy, and I'm shouting at her or trying to get her to listen on the phone, and it's pouring down of rain, and she's inside and not able to focus properly, whereas I could rest assured, had I been inside and with her, she would have derived a much more benefit from my visit simply by my being able to hold her hand, even if it was with a latex glove at that point, and talk quietly to her and share some of her favourite music. A great benefit to her. And it wouldn't have required a member of staff standing watching, because I could have been on my own with my wife in the room, but it wasn't allowed.
There was a point that I was looking for, and I think I found it. It's 152. You're talking about privacy being non-existent, and that may be apocryphal, but you seem to have made an excuse that you needed to go shopping to get away.
Yes, these are the things that induce guilt in me, because I had learned to come up with excuses to upset myself from the visit if it wasn't going well. So I would simply say to Anne, I need to go shopping now, which was a lie. I never felt good about doing it, but it was one of those situations where you couldn't linger. You couldn't keep saying, I'm going now, step back 5 paces, I'm almost gone. You simply had to say, I'm going to the shops, goodbye, and I would turn my back on her and walk away, just to try and make the thing more manageable. And certainly that left a lot of guilt on my part. It's not one of my proudest moments, but it was the only way I could deal with a situation like that.
I think you put it quite forcefully at the bottom of paragraph 153, where you say, "Dear God, I hated this. I wondered if there was any point in coming back, but I knew I would."
Yeah. I think the general public should probably understand, because we all live in family, and we all have love in our lives, and quite how the general society failed to understand how this was happening, that it wasn't seriously detrimental to the residents' health and indeed to the relatives' health. I really don't know, and I do sometimes fear that underlying this was a double jeopardy, in the sense that many of the people in care homes already had an illness or a situation that was already terribly misunderstood and had Alzheimer's. Therefore, did it matter what was happening to her? and one feels this was some form of discrimination, apart from simply the harsh application of lockdown rules.
One of the concerns you had, I think, at the time was your wife's intake of fluids and a possible concern about her kidney function. Is that right?
Pardon?
Yes, you had a concern about your wife's intake of fluids, because I think that was something in the past that you had been able to aid with.
Yes, if we were in, it's recognised in care homes that one of the great advantages of having a relative in is that they can do the kind of hour by hour, minute by minute care that often carers don't have the time to do. And an attentive relative can make sure, as best they can, that their loved one is drinking properly, etc. And so it transpired that there may have been an issue for Anne being sleepy. There may have been a reason behind that, which I was observing through the windows, but the care home were again telling me she's fine. And that is the operative word that was often used. She's fine. But she looks awful sleepy to me. Well, no, she's fine. Until she wasn't.
Let me just take a few more points. You organised what's termed an essential visit with your wife. I think, again, your daughter has explained the background to that. And you make a comment at 166 of your statement about the position after that essential visit. And you say that the relationship with the care home was now more passive-aggressive. We as a family did not want to be seen as troublemakers, and the home struck me as being overly burdened with rules and regulations, and an uneasy truce developed.
Yeah.
I think you heralded this previously in your evidence, but you had obviously, using a word that you used before, reached some sort of accommodation with the care home.
Yes, I'm appreciative of the time. We had arranged a review because I had been worried about the sleepiness. As part of that review, I asked that her health be checked. They checked on her health, 2 blood tests. Transpires there were serious problems with her bloods. And the hospital at home team had to visit 2 or 3 days later. Matters were resolved, and as a result of that, we managed to finally negotiate, I put that in inverted commas, an essential visit. And because we, as a family, had pushed the button to say we want a social work review. And if we hadn't done that, then there remains, the possibility that she may have deteriorated further. But we were being told she was fine when the blood test clearly said she wasn't fine.
Okay. I'm also conscious of the time, Mr. Duke, so forgive me if I do take things relatively quickly. You make the point in 168 and then further on about the visiting rules during lockdown were not proportionate. And I think that remains your view now.
Yes.
2 years on.
Yeah.
You also say at 173 to 177, you record that 23 people died of COVID in your wife's care home, and your wife nearly died, and you set that out. And you also say at 175 that we never took the virus in because we were not allowed inside. And that seemed to be your perception.
Yes, and it goes back to 13th of March when I was told you will bring the virus in, rather an uneducated viewpoint, frankly, I think, because it wasn't us. Inevitably it came in through the care staff, and that's not because I'm blaming them, but there had to be some vector for it, and therefore it seems that very unfair that we were simply sanctioned, whereas other people, care staff, were always coming in and out, and nobody was checking what they were doing at the weekend. Nobody was standing outside their house with a key, only outside my wife's house.
Now, again, I want to just take these points briefly, and perhaps I can just make the reference to it. Paragraph 185, you talk about the arrangement that you had with your wife to assist her with eating, and you had to apply for effectively permission to do that. And even that itself proved problematic.
Yeah. Unforeseen consequences. The fact of the matter was that on the day, at that moment, the care home industry, from the First Minister down, was represented by whichever carer was standing outside Anne's room. And their interpretation, or whatever interpretation, or somebody else's interpretation of guidelines that they had on the day, and that would often change from one carer to the next. So even although I got permission from the manager to feed Anne, that carer was uncertain if that was the case, and the manager wasn't available, and the carer erred on the side of caution. You cannot feed her, and I erred on the side of caution by not making a fuss about it. More guilt.
Yeah. Just again, you make reference to a garden visit. This is in paragraph 196, and you explain some of the movements around that garden visit. This was on the 26th of May 2021, which included a postman, 2 members of staff, a tradesman, other relatives entering the building and exiting past Anne, our daughter, and me. And you said this was an outrageous repeat of an earlier incident that you'd experienced.
That was the incident which resulted in the upheld complaint,
yeah.
And yet it happened again.
Yeah. Can we just go on to paragraph, I think it's fair to put this to you. This had quite an impact on you. And paragraphs 207 and 208, I think you reflect the toll that it did have on you. You were ill.
Yes, I'm again conscious of the time. Very briefly, I have a pre-existing heart condition. The constant stress of dealing with all of these issues seemed to accumulate into one rather tetchy phone call, well-mannered but tetchy phone call between myself and the care home manager. It wasn't going terribly well, and I ended up taking unwell. I ended up in hospital with a heart event, as they are known. And I'm certainly quite clear, and I'm not saying, and I want to stress, that the care home manager caused that heart attack. But the stress of that particular incident, I'm clear in my mind, was the accumulation of all that stress. Many people had psychological stress, emotional stress. My heart registered my stress, and it could have been fatal. Yeah. But I'm here.
You are indeed. Just one point from paragraph 213 on infection control, and perhaps a significant point, and perhaps one that can be overlooked. You say in the middle of that, your wife would never have seen a human face with a smile on it in that time because you were always having to wear PPE and masks.
Yeah. Sorry. Yes, so little is understood by what was going on. Imagine the fact of the matter was, quite probably, if everybody was obeying the rules, my wife never saw a smiling human face for the last 20 months of her life. It's as simple as that.
Briefly, and I do this deliberately, Mr. Duke, and I would have done it notwithstanding the time pressure. I don't want to take you through the passing of your wife. But you were able to be with her when she passed. Yeah. Unfortunately, one of the things that was done, as she had been in hospital and been returned to hospital, the planned quarantining of your wife was reduced in terms of the time, I think to 5 days, and I think you're very grateful for that.
I'm very grateful too, but I had to plead for it.
Yes.
The rules at that point said that although she was coming back from hospital for end-of-life care, and she had received 2 negative COVID tests, the rules said that she should have been placed in 14-day quarantine, and she had a barrier nursing sign hastily taped onto her door. I managed to renegotiate that with the care home manager, and I am grateful for that.
Yeah. Now, You've told us that your wife passed away at 6 minutes past 2 on the afternoon of the 13th of November. You were able to be with her, your daughter Natasha wasn't, and we've heard that earlier. Can you just finally read what you've set out in your statement at paragraph 245 and 246?
Okay. And in her last hours, we finally held hands. I stroked her precious hot flushed cheeks, cuddled, and yes, I took off the damn mask and kissed her. But what a god-awful price she had to pay for such warmth and intimacy. In those last few hours, we sang and kissed and cried, and we reminded her that she was truly loved. It should not have been so. 246 is a poem. I don't want to necessarily indulge myself.
Okay. No, that's fine. But you've penned a poem about the situation.
It's in the book.
We're appreciative of that, and we'll get it in literary form in due course. Thank you. You make the point in 247 that the government must never again be allowed to imprison our most frail and vulnerable in such an inhumane way. It has been despicable, heartless, and relentless.
Yeah.
Again, you adhere to that view.
It's an easy thing for an emotionally distraught husband to say, but sometimes genuine change only comes about when people will stretch themselves, will blow whistles, will make a noise. I pay full credit to everybody working in Care Home Relatives Scotland. We stood up and said, this is wrong. And if anything is to change, it will be because some people have said that was wrong.
You make certain suggestions of lessons to be learned and hopes for the inquiry, and we can read those, Mr. Duke. I don't ask you to read them out, but I think one of the points is that you hope that the inquiry will make a recommendation that Anne's law, as petitioned for by your daughter, is enacted. And we know the deficiencies that your daughter sees in Anne's law, so we're aware of that. You also say it's important to allow people to speak. It is cathartic. How have you found this cathartic?
It has been very valuable. I deeply appreciate the opportunity. I wish I had more time, but there we go. But it has been very worthwhile, and I'm grateful for the opportunity. Yeah.
Well, we're very grateful to you, Mr. Duke. Thank you very much. And we've just made the time.
Thank you very much, Mr. Duke.
Okay, thank you.
Very good. We'll rise till 2 o'clock.